Hi, my name is Ashley, and I work with Children's Wisconsin's communications team. I'm here today with Dr. Michael Gutzeit, our Chief Medical Officer at Children's Wisconsin. We're going to talk a little bit about coronavirus, or more specifically, COVID-19. It's something you've probably seen in the news in the last few weeks. Thank you for being here, Doctor.
You're welcome.
Let's start with some quick background on COVID-19. What is it?
This is a very timely topic, isn't it? Given that the World Health Organization has declared this a pandemic and that our state health agencies have declared it an emergency, for a public health emergency within the state of Wisconsin. So I'm really thankful for the opportunity to share some information. COVID-19 is caused by coronavirus. Coronavirus is a fairly common virus, and like many other viruses, it can mutate and change over time. What's happened is that COVID-19 is a new form of coronavirus, which is which is present in the population right now and is spread. It started in China, and it's spread throughout the world, and that's why the World Health Organization has declared it a pandemic.
Okay. Parents are really concerned. We're seeing it quite a bit online too, a lot of news about it. What should parents be doing?
Lots of really good questions coming from parents and families who are obviously concerned, and rightly so. Because this is now a state public health emergency as well as a pandemic, we need to talk about that. And I think first and most importantly is remember the basics. Washing hands is a very good way to prevent the spread of this virus. Another concept that has come up has been social distancing. It's a term that's being used quite frequently and may be confusing to people. Social distancing means staying away from large groups of people and practicing good public health measures that prevent the spread of this infection. The infection is spread by respiratory droplets, which are usually caused by coughing or sneezing. And so those are the types of ways that this can be passed. So we want to make sure that we're very thoughtful and careful about being in large crowds.
Sure. And if they're concerned about it, should they be going into their doctor's office or the hospital?
The first thing to do would really be to call your primary healthcare provider and talk to the primary healthcare provider about the symptoms that you or your child may be experiencing and getting information from them about the proper way to approach this, whether testing is advised or not, and really getting that information from a trusted individual, your primary care provider.
So a family should talk to their primary care doctor. That primary care doctor would screen them, right? Ask them certain questions about where they've traveled, if they have the right symptoms, and if appropriate, they would then be directed to get a test.
Yes,
that correct?
that's very important. The initial conversation should occur before any decision about actual testing occurs. So actually, as you referred to it, screening is asking a series of questions. Testing is doing the actual physical test itself to test for coronavirus.
Okay. And is Children's a place where people can come in and get the official test? Is it a testing location?
I would strongly urge people not to come to Children's for public health testing. Children's is not a public health site. We do not do public health testing. However, it is important to understand that testing is being done. We are working very closely with local health departments, with the state of Wisconsin, their Department of Health Services, to understand where the best places for patients and families and children to get testing done is going to be.
Okay. Has Children's Wisconsin seen any confirmed cases of COVID-19 yet?
That's an interesting question because we know from the experience that other countries and the United States have had is that COVID-19 does not seem to be affecting children as severely as it's affecting adults. However, we do know that there will be children that will test positive. Fortunately, we have not had any children here in our state who have tested positive for COVID-19, and we are continuing to look, and that's why doing testing is important.
Okay. So what is Children's Wisconsin doing to help stop the spread of COVID-19?
Like most other organizations across the country right now, healthcare organizations across the country, we are invested in promoting the best and safest care for our patients. And there are several things that we're doing right now. We're meeting regularly on a daily basis and even more frequently than that with many committees, many people within our organization to determine the best ways to prevent the spread of this infection. What we're focused on is really trying to maintain an environment that promotes health and allows people to come here and be safe when they're in our environment. And that means that we need to do screening, we need to do other things to make sure that we're very careful and very thoughtful about who's entering our system, and we're asking questions about people. But also internally, we're trying to make sure that we protect our staff. As we said, this is a disease that tends to affect adults, and so we want to make sure that our staff are healthy so they can continue to provide the best and safest care for our patients.
Sure. How does COVID-19 affect babies, children, and teens, bouncing off what you just mentioned about it not impacting them quite as much?
Yes, the COVID-19 does not seem to affect children as severely as it does adults. Many children that get COVID-19 appear to get mild respiratory symptoms, maybe a runny nose associated with a fever, a cough, maybe some breathing difficulties or muscle aches. Those tend to be the things that we see in children. A minor respiratory symptoms for the most part. Much more concerning in older adults, but I would also add that children who have underlying health conditions, as well as adults who have underlying chronic health conditions, are more at risk. So we need to be very thoughtful about when symptoms develop in that group.
Yeah, do you want to expand upon that? How does COVID-19 affect children who are immunocompromised or have other chronic illnesses?
It can be a more severe illness in those who have underlying health conditions because it stresses the system even more than a mild illness would. So if your child has a chronic underlying condition, if they're immunocompromised or they have a health condition that would otherwise affect them, it is very important for parents to be talking to their primary health care provider and other providers if symptoms develop.
Okay. Many parents are wondering, how should they talk to their kids about COVID-19? It can be confusing.
It can be, and I think it's important to be honest. COVID-19 is a virus. Like many other viruses, it can cause an illness. And I think the way that parents should talk to kids is to just share with them the importance of making sure that they're doing the preventive measures, washing their hands, trying not to touch their face. If they're sneezing or coughing into your shoulder or your arm, and then washing their hands afterwards. The other thing that's really important is we have seen some school closures, and so that is a clear indication that that there are some issues that are causing some concerns in the population. So we want to make sure that parents talk to their children about why school closures are an important public health way to prevent the spread of infection. While the kids might think it's a holiday, it's really a public health measure that we're focused on. I would also add that if individuals have concerns and would like to get more information, we certainly have a website, chhw.org/coronavirus, which has information, and we can get more information about that.
Yeah, and a really easy way to get a hold of a doctor through Children's is childrensfromhome.com. That is where we have our online urgent care system, so people could talk to someone over their phone or a computer.
I'm really grateful that Children's has put this opportunity out there because it allows the information about sickness and illness to be discussed with a qualified health provider in a way that does not run the risk of exposure by coming into an office setting where there might be other people that might have an infection.
Yeah, and that's a way too to connect with a doctor, like we mentioned before, to do that first step. If someone is concerned and they might want to get testing, that first step is talking to a doctor. So you can go to childrensfromhome.com to talk to that doctor as a first step, and then potentially they'll work with a public health department to figure out the best way to test that child, right?
I would agree.
Okay.
And Children's is constantly updating its public website so that we have the most current information. That information is changing very rapidly. I'd also encourage people to reach out to their public health departments as well as Wisconsin Department of Health Services, which are all trusted resources, as is Children's and their primary care provider.
Yeah, let's end on that. Just a reminder that you can go to chw.org/coronavirus for updates. We'll be providing updates there as much as possible. Thank you, Dr. Gutzeit.
You're welcome. Thank you. Stay healthy and wash your hands.